Hello, this is Dr. Do again. This video is alphabetic list of problems. I have finished from A to F, which I think are important and just common conditions. And today I'm going to talk about start with the letter G, and the first thing came to my mind is glaucoma. I had some previous video, but it's in not in English. So I figured I'll just use this video to talk about the glaucoma because it is quite common, and also the starting age was not as previously said. I thought was like in older people, older than 50, but currently I think the glaucoma can occur in younger people around 50 or before 50, and also there are some subtle problems, subtle symptoms. Without elevated the pressure, without objective pressure elevation. So what is the glaucoma? Is any situation associated with glaucoma warrant emergency visit? Yes. The glaucoma, which there are two kinds, which is the what are the angle closure or open angle or glaucoma. For the closed angle glaucoma is an emergency. These kind of people usually it's usually unilateral, feel severe ocular pain around the eyes and even headache, and the eyes swelling, tearing, and couldn't see clearly, vision start to be hazy. So if that's the case, particularly in Asian population, because we have the longitudinal short eyes, so that which increase the closure angle glaucoma, increase the risk, and it's quite common. So if that's the case, you need to see the emergency or talk to your ophthalmologist. If it's weekend, usually the eye physicians, their office is closed during weekend. So if it's weekend, then you need to talk to go to the emergency right away. If it's weekday, talk to your physician and talk to your ophthalmologist to get diagnosed and treated right away to lower the pressure. So having talked about that, this is just the emergency situation. Can you manage at home? I think at the beginning of diagnosis, or usually it's not manageable at home. I think it needs to be managed with medications. You have to see your physician and refer to your ophthalmologist and to prescribe medication to manage. So usually it's not manageable at home unless your physician think your eye pressure is stabilized and you can just use the eye drop regularly, follow up. But that still is not self-management. Still need a prescription, prescribed medication from eye physician or from for lower the pressure. So having said that, what is the glaucoma? Before we talk about the glaucoma, I need to talk about briefly eye structure and some fluid called aqueous fluid. So this is the fundamental knowledge. So in our eyes, we have tears. That's one kind of the fluid. It's produced by the lacrimal gland and flowing through the ocular nasal duct to the nose if it's over tearing. But there's another fluid. It's subtle. We cannot see it. You cannot see it. But it's produced by the called cilia body, which has a potential ability to produce. It's a cilia process and the cilia muscle together called the cilia body. So the really produced aqueous fluid is the cilia process. Produce this fluid from the back of the iris, which is the black part, and flow into the front, the anterior chamber, which between the cornea and the lens, cornea and iris. So, and in that microstructure, there is some meshwork and also trabecular meshwork, and also the Schlemm canal through this circulation back to the blood system. So these are the briefly, there's a fluid, we cannot see it. it's not a tear, but it's just called aqueous fluid. So this fluid has to go through the anterior chamber, anterior angle, that's what I mentioned, and through the meshwork and also through the canal back to the blood supply. So this is if the angle getting narrowed between the cornea and the iris. If this angle getting narrowed, then the fluid cannot flow into the blood system, so which accumulate in the eye, and from the posterior chamber to the eye, and increase the pressure inside of the eyes, so which can damage the ocular nerve, optic nerve, which is on the back of the eyes. So this is basically fundamental knowledge about eye structure, about the aqueous fluid, and also the mechanism of the glaucoma. So if the glaucoma happened at the beginning, probably asymptomatic, and just identified during the regular ocular ophthalmologist office visit or your primary care physician annual physical to measure your eye pressure and elevate it, but without symptoms. Or there is a special glaucoma nowadays. It's called a normal pressure glaucoma, which means that the glaucoma, the optic nerve is damaged or undergoing damage, and then the pressure is normal. How to know whether the optic nerve is damaged? With or without the visual field impaired. It's measuring there's a special measurement in the physician's standard. They measure the cup and the disc, which is use this ratio to see whether there is a possibility of nerve damage. So this is about the fundamental knowledge of glaucoma. Anyway, and also the other things why there is a normal pressure glaucoma. Probably the pressure is not normal, but just when you visit the ophthalmologist, it showed normal, because there is a bimodal elevation of the intraocular pressure. So this the pressure probably is very high in the morning. It's for everybody, it's high, but it's normal probably, or abnormal. If it keeps going for a while, then we'll just really, because the pressure of the eyes increased, so damage the optic nerve. So this is the fundamental knowledge about the glaucoma. And this doesn't have to be angle closure. The angle is still open, but just the intraocular pressure is elevated, also can increase the risk of damage to the optic nerve. And eventually, what is the worst complication of this glaucoma is lost vision. At the beginning, just the vision field impaired. You cannot see the whole visual field, either one with some obscure damage or just limited. So what can you do? You can just always test about yourself, visual field. You look straight and you move your fingers, see whether you can see it. This is one way to see whether you have the visual field damage. Or you just need to see your physician regularly, and if you have family history of glaucoma, definitely, even though you're younger than 50 years old, you need to let your ophthalmologist or your primary care physician know that, and then they will keep following you, see whether there is any trend of increased cup disc ratio or increased ocular pressure, or monitor your visual field regularly. So this is about the general knowledge, and also taking home message is to see your physician regularly, and you can test your visual field, just brief, see whether there is any trend, any possibility that the visual field is getting narrowed or getting impaired. So this is the video. I'm going to stop here about the glaucoma, and I hope it helps. I thank you for watching. I will see you next time.